Hello, my name is Dr. Brock Allen, and I am Director of the SDSU Center for Teaching and Learning. Today I will talk about current perspectives in psychology, a topic that was briefly covered in Chapter 1 of your Psych 101 textbook. Before I start, I would like to ask you to read the statements on this slide. Please take a few seconds to read these statements and to click on the statement that is most similar to your own views. We're going for first reactions here, so you don't need to give this much thought right now. Please click your answers now. Looking at the chart in the lower right, it appears that students in this session hold pretty different views on psychology, or maybe not. Perhaps you felt a little uncomfortable in being forced to select one response to represent your views. Your textbook introduced perspectives in psychology such as behaviorist, psychodynamic, humanistic, biological, cognitive, evolutionary, and sociocultural. Chapter 1 characterizes these as current perspectives in psychology because they represent powerful ideas for explaining what makes people think, feel, and act the way they do. Each perspective originated in different historical movements within psychology that used different methods to investigate psychological phenomena. Understanding a little bit more about these perspectives can help you to make better sense of what you'll learn in Psych 101 and perhaps how you might apply what you learn to different situations in everyday life. I will focus on two perspectives, the behaviorist and the psychodynamic, and I will try to tie in a couple of others that are outlined in your chapter. Please be sure to study the other perspectives in the last sections of that chapter. I would like to clarify something before I move on. Even though we label these as different perspectives, most psychologists examine issues from multiple perspectives. One way to think about the term perspective is that it's a metaphor. Visually, when people adopt a perspective or point of view, they position themselves to see certain aspects of something, like sides of a mountain or a building. By using the perspective's metaphor, I want to remind you that there could be other points of view that would allow you to see other aspects. Trying to decide too early on a single best perspective could prevent you from exploring the whole field of psychology. So it's important to remember that even though these perspectives represent different approaches on the central issues of psychology, most psychologists examine issues from multiple perspectives. Examining issues from multiple perspectives allows psychologists to have an enhanced understanding of human behavior. Let me return to the two perspectives. Here are the student learning outcomes for this lecture. Most of you have heard of Sigmund Freud, who is usually considered the founder of the psychodynamic perspective. He began his career as a physician specializing in disorders of the nervous system, but he became interested in patients whose symptoms didn't yield to ordinary biological explanations of disease. So Freud developed a method of treatment in which his patients would talk about themselves, and he and the patient would then collaborate in analyzing what these thoughts might reveal about the psychodynamics of the patient's unconscious life. This essentially was the beginning of psychoanalysis. Freud's main propositions were that people are pulled and pushed by a complex network of inner and outer forces. Our behavior is not always rational. It's driven by internal motives rather than by our conscious awareness. And childhood and early family relations set the stage for personality development. So the term psychodynamic suggests that our interior mental lives balance various forces or influences that are constantly changing and adjusting to each other. Freud thought that all human beings encounter challenges in their early childhood that shape unconscious desires in later life. For example, early on, when infants are very close to their mothers during breastfeeding, the presence of the father may seem an unwelcome intrusion, even an interruption of intimacy with the mother and the satisfactions of nursing. As children develop, they usually learn to manage these feelings about the father. But in dysfunctional families, where the father is insecure and envious of the child's special relationship with the mother, the issues sometimes remain unresolved at an unconscious level that can influence the child's sexual attitudes later in life, as well as in conflicts with father-like authority figures. Patients may not remember these particular incidents consciously, Freud argued, but they can profoundly affect the way they view themselves and others. Freud is famous partly for his psychodynamic model of the human psyche, in which three aspects are constantly interacting: the id, the ego, and the superego. The id represents drives associated with the basic biological needs, such as hunger, thirst, and sexual appetites. In contrast, the superego represents a kind of stand-in for parental authority. So when an infant is attracted to its mother's breast and desperately wants to suckle, the id is in control. But as the infant grows up and becomes nippy, the mother might indicate displeasure and even brusquely remove him from her nipple. This is the kind of experience that gradually shapes the superego, the aspect of the psyche that is concerned with the demands of family and more generally society, that the basic instincts of the id be suppressed and controlled for the good of others, for the good of the social order. Further development of the superego might occur when the child is a toddler and steals food. When the mother sternly tells the child to put the food back, she's exerting parental authority. When the child internalizes her expectations, he's building up his superego. Here's the key. In Freud's theory of the unconscious, the third aspect of the psyche, the ego, works as a kind of mediator that balances or resolves conflicts between the id and the superego. Although people are often unaware of its balancing acts. This usage of the term ego is different than our popular use of the term egotistical to mean self-centered. So the id and the superego are often in conflict. But imagine if the superego was completely in command all the time, was successful in mostly suppressing the id. What kind of person would result? Would they be good? Well, we could have people who are overly obedient to authority to the point of being passive and repressed. A person with a very strong superego might seem kind of saintly, foregoing the pleasures of the material world. But perhaps one could ask whether one should ask whether a person who chooses to renounce materialism is making a conscious choice, or whether certain forms of self-denial involving food or material rewards might result from inner compulsions or psychological imbalances. Freud's idea of unconscious forces and wishes have influenced popular culture enormously. Before Freud, for example, people gave little thought to dreams as an expression of unconscious fears and desires. or the idea that symbols might have particular meaning to the unconscious. Psychoanalysis, Freud's original talk therapy, is not as fashionable as it once was, and it appears to work better with patients who are psychologically minded and willing to learn how to talk freely with the therapist. One thing to consider is that psychodynamic methods for treating mental illness are limited, and they're expensive because they require trained therapists working on one-on-one or with small groups. So they're often not covered by medical insurance. On the other hand, there's great concern among some psychiatrists that drugs like Prozac, a widely used antidepressant, mostly treat symptoms and won't help to address underlying causes of the symptoms. However, we have come a long way. Before the advent of modern psychiatric medications, psychiatrists working with severely depressed or psychotic patients in the 1940s and 1950s did not have many options for treating them. Doctors sometimes had to use very primitive methods, like putting patients in straitjackets or wrapping them in wet sheets to calm them down. Sometimes they used methods that seemed cruel today, such as electroshock therapy. But the underlying problem was that medicine in those days had very limited understanding of brain biochemistry. Now I will shift to the other perspective that I will present today, the behaviorist perspective. When you hear the word behaviorism, you may think of ringing bells, salivating dogs, and conditioning. Some of you may have heard of the terms positive and negative reinforcement in relation to rewarding children and altering behavior. Those of you who have been to SeaWorld might have noticed how trainers reward the dolphins and killer whales. They either give them fish or pat them after tricks. So while the behaviorists have conducted much of their research with animals, their principles of behaviorism have been applied to human beings and human problems. Overall, those who endorse the behaviorist perspective are concerned with the central question: in what ways do environmental factors or stimuli influence particular responses? In considering the differences between the behaviorist perspective and the psychodynamic perspective, it's useful to remember that psychology was considered a branch of philosophy until the early 1900s. Even scientifically trained pioneers like Freud often wrote in a style that sounded more like philosophy or history than science, with book titles such as Moses and Monotheism, Civilization and Its Discontents, and Beyond the Pleasure Principle. Behaviorist psychologists such as John B. Watson and B.F. Skinner argued that psychology would never mature into a real science until it abandoned its tendency towards undisciplined speculation and assertions that couldn't be supported by hard laboratory evidence. They criticized psychodynamic theories like Freud's, relentlessly asking, where is the evidence? Where are the observations to support the assertion that entities such as the id, the ego, and the superego actually exist? They argued that psychologists should focus on the observable, and they argued that what can be observed are the behaviors of organisms and people, not the internal processes of their brains or minds. Now today, of course, we have brain scanning machines that actually allow scientists to see which parts of the brain are working when people are solving a puzzle or playing a piano. But in the heyday of the behaviorist perspective, There was no practical way to see what the brain was doing. Thus, the behaviorists proposed that the brain should be treated as kind of black box. They said it was unscientific and even delusional to suggest or guess at the brain's inner workings, because there was no way to verify these ideas. The more radical behaviorists condemned as unscientific all theorizing about how the brain perceives, remembers, and reasons, how it makes sense of language and symbols. Needless to say, these radical behaviorists didn't appreciate the concepts of the id, the ego, and the superego. They insisted psychology should focus on the inputs to the black box, the stimuli and the outputs, the environment and the behaviors. Consider Skinner's famous ABC model, antecedents, behavior, consequences. The subject, an animal or person, experiences some situation or stimulus. This is the antecedent, which basically means before. The subject behaves in a certain way in response and then experiences consequences of that behavior. So going back to the suckling infant example I described earlier, the hungry infant sees the breast, the stimulus. Instinctively it roots, finding the nipple, and begins sucking. This is the behavior. The consequence is the flow of warm, satisfying milk. What began as an instinctive behavior of rooting and sucking is strongly reinforced by breast milk. In other words, the infant is even more likely to root and suck the next time it's hungry and sees a breast. Once a sequence like this is learned, it's called a stimulus-response sequence, because the stimulus elicits the response. But suppose the mother isn't lactating due to a painful breast infection. The consequence is different. No milk. The mother pushes the infant away. The instinctive behavior is not reinforced. After many such rejections, the infant might be less likely to root and suck. Was the infant who was denied milk conflicted? Would the mother-child bond be damaged? The radical behaviorist would have argued that there's no need to speculate about internal mental mechanisms that can't be verified. Skinner's research work led to the development of the theory of operant conditioning. Operant conditioning describes our behavior as a response to certain specific consequences in the past. So if you get a speeding ticket, it's more likely that you will drive within the speed limit when you drive on the same road in the future. But there are also positive examples related to this principle. For example, if person A gives person B a kiss when they receive flowers, person A might be more likely to give person B flowers again when they wanted a kiss again. Positive reinforcement is used for educating children and for modifying behavior in patients with certain psychological disorders. Skinner argued that the gambling industry makes extensive use of operant conditioning principles, and he'd like to point out the similarities between animals pulling levers in his famous Skinner boxes and the repetitive lever pulling of people who play slot machines. Skinner's work with operant conditioning focused on vertebrates such as rats and pigeons. But one of the striking discoveries in recent years is that even much simpler animals can respond to operant conditioning, including, for example, fruit flies. Using operant conditioning, researchers have trained fruit flies to follow simple mazes to find food to avoid electric shocks. or to avoid electric shocks. So stimulus response reinforcement works with small insects too. As described in a recent issue of the journal Science, detailed video analysis of fruit flies in laboratory studies reveals complex social behaviors. Males compete for females and engage in boxing matches using their front legs. They also engage in courtship rituals with the opposite sex, but sometimes they're rejected by females. These activities involve a lot of learning that can be measured in increased connections between the fly's nerve cells. Also, flies that engage in these social activities need more sleep and take more naps than flies that are kept in isolation. Of course, flies don't have very complex nervous systems, so the kind of psychodynamic issues that concerned Freud probably don't apply. To summarize once more, keep in mind that each of the two perspectives I have presented rests on different assumptions, and each leads to different ways of looking for answers to questions about behavior. However, remember what I said in the beginning. Psychologists examine issues from multiple perspectives, and today, psychology can be seen as a synthesis of ideas that seemed contradictory in the past. This completes our session. We're out of time, but feel free to meet me after our session or call me if you would like to talk more about the topics I presented today or any other topics of interest. Thank you.